When you are poor and homeless, you are not just compromised in that you don't have a home.
By definition, having a mental health condition means that you have symptoms over time, and those symptoms are either causing really significant distress or impairment in functioning in some life role, whether it be going to work or school or having relationships with other people.
Well, it's true that things would be a lot better if we all had housing and homes. But I think what has happened for people who live on the street and in homeless supported shelters is that your health is so compromised from years of being beaten down by lacking access to nutrition, rest, appropriate preventative health care of your body as well as your teeth, that over time you get worn down.
We'll see commonly that individuals start to have less contact with family and then maybe none. Maybe had friends in the past, and then over time they kind of dissipate or disappear. And the person is kind of left isolated or disaffiliated, disconnected from other human beings. You know, having a mental health condition means that you're at greater risk for developing homelessness because of that difficulty with functioning. And then it goes the other way. Once you're homeless, it's mighty hard to be emotionally healthy.
And so I think when people come to us, they really are exhausted and very sick.
Nobody wants to be homeless. Nobody wants to be homeless and sick.
Dealing with barriers to care to our participants is something we deal with on a day-to-day basis. Whether it's a systems of care issues or whether it's a participant issue, we really need to be very aware on how to address them, how to deal with them, and how to be able to circumvent those barriers.
I see a number of people who have maybe been in the healthcare system before. Commonly, at the time of homelessness, people are disconnected from the system.
I can think of tons of barriers. You can think of transportation issues. You can think of how many days it takes to get an appointment.
Thinking about where you're going to stay, what you're going to eat. It's important to prioritize those things.
You can think of cost of procedures. You can think of cost of medications.
If I am a homeless individual with schizophrenia and I need to figure out if I can get into the shelter or not, and I know I need food, but the mental health clinic told me that I should come at noon, and that happens to be when the meal is served, I might feel the need to pick satisfying basic needs first before thinking about getting to that appointment.
Our healthcare system is so complex that it's very difficult for someone like me sometimes to navigate that system. I've been to medical school, I've been to residency program, I deal with the system on a day-to-day basis, and sometimes it's very complex for me.
Whether it's hospitals or clinics or dentists or legal agencies.
It's very difficult for our participants to knock at one door or knock at two doors or and when you ask them that, you know what, now you need to knock at 4 more doors with staff that might not be sensitive to your issues, that might not be, trained to deal with participants like them.
Which really keeps them from going anywhere, whether it's a soup kitchen or an access center or a shelter, clinic.
And putting our participants on their own to deal with the system is by itself very challenging.
As a psychiatrist who also provides care to homeless individuals, I see that it's what we would call an enriched sample. The prevalence of mental health conditions in the homeless community is very high. I'm thinking of one study that suggested that about 2 out of 3 homeless individuals have some behavioral health problem, be it a mental health condition, a substance use condition, or both. It's incredibly common that we see people who have co-occurring mental health and substance use disorders, and we consider it to be the expectation and really not the exception.
They are looked down upon by society as well, and not just passively, but actively. And people who are on the streets who appear homeless, people won't look at them, won't talk to them, even if they're talked to. They are people actively yell and say nasty things to them, and that's the kind of thing I'm talking about. And when I first started working for Healthcare for the Homeless, And hearing people's stories about patient stories about how they ended up homeless, you of course realize very early on the huge myth that anyone chooses to be homeless. But not only that, but how much people suffer by being looked down upon, and people are very traumatized by that, and they're not treated with dignity and respect, and you start to believe that yourself, that you don't deserve dignity or respect because that's how you're treated.
One of the main things is violence, is why I'm homeless, because of physical violence. I've been almost murdered and hit in the head with a mag flashlight, not an ever-ready, a mag flashlight. My eyes were swollen. Sometimes if it gets really wild, I still shake. You know, I have to stop. I have to get away from it and stop seeing it.
To me, homelessness was a total devastation. I was a registered nurse. What it was, I do and walk in the streets.